Hello, everybody. Thank you for joining the 5-Minute Brainstorm, our weekly Wednesday webinar. I'm Chris Orestes, and it's really a pleasure to have you joining us once again this week to talk about 5 things people need to know about qualifying for Medicaid. You know, it starts with the fact that people have false and misinformed assumptions about long-term care. Many people think that in their lifetime, they're never going to need long-term care services. And if by chance they do, somehow it's going to be covered one way or another, insurance or a government program, or somebody's going to cover their long-term care needs if in fact they ever actually need it. The truth is that as many as 75% of people over the age of 65 are going to need some form of long-term care in their lifetime, and can be very surprised to find out how expensive care can be, whether it's home care, assisted living, memory care, or skilled nursing home care. These are very expensive propositions, and not all of them are covered the same way. Less than 8 million people in this country own a long-term care insurance policy. Health insurance and Medicare won't even cover long-term care services. So Medicaid ends up covering about half of all long-term care expenses in the United States today. So let's talk about things you need to know about qualifying for Medicaid. First, let's be clear, Medicare, you'll qualify, everybody will qualify at the age of 65. Social Security, everybody qualifies starting at the age of 62. Medicaid, though, is a means and medical needs-based program. So qualifying for Medicaid is going to be based on financial and medical criteria. Medicaid recipients can't have more than $2,382 currently as of this year of monthly income, and can't have more than $2,000 of assets. So somebody who's going to apply for Medicaid is going to be subject to a 5-year look back of all their assets and income to see how it's been disposed of, where it is, where it's gone, because there are very specific rules about the value of assets, what can and can't be spent down, what can and can't be gifted or put into trusts. And over a course of 5 years prior to application, all of that is going to be reviewed by Medicaid. Need for care is also important. Need for care is it needs to be certified by a physician, looking at things such as activities of daily living, cognitive function, mobility, and somebody's need for 24-hour care. Once somebody does qualify for Medicaid, they're then considered a ward of the state. They're impoverished. They're below the poverty level. So they are in the hands of the state, but there are spousal impoverishment laws that will protect spouses from things like losing their house, losing their vehicle, losing their income, and losing assets. In the process of qualifying for Medicaid, a spouse can be exempt from much of the criteria, and they will not be put in the same position of impoverishment as the person who's applying for Medicaid to qualify. Most Medicaid recipients are going to receive care in a nursing home. Once you're accepted, coverage is guaranteed for life. So if somebody is approved for Medicaid, that coverage can't be taken away from them. But for the most part, they're going to receive their care in a nursing home. And that's important because people need to understand really that at the end of the day, Medicaid is the payer of last resort. It's not the first resort. It's not the first thing anybody should be thinking of as what's going to cover their care, because qualifying for Medicaid is a rigorous screening process. And if anybody doesn't report correctly or withholds information, there's some serious penalties that will disqualify somebody from qualifying. And then once you are on Medicaid, well, congratulations. Now your choice is pretty limited. The choice of somebody picking the type of care they want, the location of care they want, is pretty limited, and it's tightly controlled by Medicaid. Receiving care outside of a nursing home is actually pretty rare, and you have to go through a waiver process, apply for waivers. There's no guarantee somebody's going to qualify. They're very limited. And it's pretty rare for somebody to get a waiver to receive care at home or in a say assisted living environment paid for by Medicaid. It's not impossible, but it's rare. So if you're going to get on Medicaid, you've got to understand you're going to go through a process verifying that you're below the poverty level. You have the medical needs now. And once you're on Medicaid, you're actually most likely going to be in a nursing home sharing a room with somebody else. It's why it is the last resort choice, not the first resort choice. If you're private pay, then you're in control and have choice of anything you want to do. On Medicaid, it's the reverse. So thank you everybody so much for joining this week's 5-Minute Brainstorm. I'm Chris Orestes, and it was very much a pleasure to talk to you about 5 things you need to know about qualifying for Medicaid. We look forward to being able to talk to you again next week on the weekly Wednesday webinar. Take care, everybody. Goodbye.